and start using like microscopes, magnifying glass to look at these meridians and acupuncture points. They even dissect the tissue and see. And they came up with the conclusion that acupuncture points are just figment of the imagination. You can't see them, okay? It's supposed to be a point, this is supposed to be a point, this is supposed to be a meridian. You cut it, nothing special, okay? They don't seem to correspond to any particular class of structure that's known to Western medicine, such as blood vessels, no. Nerves, no. Tendons, no. Muscles, no. It doesn't seem to correspond to anything. And if you look with a microscope, nothing special, okay? But now, 2015, we know so much more about acupuncture points. So yes, first of all, acupuncture points do not correspond exactly to any specific class, okay, of anatomical structures. They're not nerves. Meridians are not nerves, not blood vessels. They are not tendons and so forth. Acupuncture points exist at different depths, structure, and the activity even changes depending on the time of day or the season and so forth. So it's not a very fixed thing. But now we compare some of these points to points that we in Western medicine know about. Okay, we say, many, but not all acupuncture points correspond to nerve annexes. So many acupuncture points, in fact, correspond to junctions of nerves, but not all of them. Okay, many of them correspond to what is known as trigger points to Western medicine, or to motor points, or to referred pain points, or to connective tissue planes. In other words, yes, some of these points we can say they correspond to something we in Western medicine know, but there are over 300, 400 points, and there's no general statement you can make about what acupuncture points are. Okay? And now, this is obvious because they were all discovered by accident. They are called acupuncture points because they work, not because they belong to a certain class of sites like nerve nexus and so forth. So, next, the biological or physiological effects of acupuncture. Okay? So, what exactly happens when you put the needle in? Okay? From a Western medical point of view. UC Irvine just completed a very detailed and comprehensive clinical trial on whether acupuncture can relieve high blood pressure. This was a landmark study because in this particular study, number one, unlike many earlier studies, all the patients tested had to stop whatever medicine they were using. That had always been a confusing point. Because when people are taking medicine and they get acupuncture, they get better. Well, you don't really know. Is it acupuncture or is it the medicine? So in this one, they only took in patients who were willing to stop whatever medicine they were taking. Number one. Number two, okay, in this series, I talked a lot about the placebo effect. If you think something works, it will work. Okay, so in this case, it's a placebo-controlled, randomized controlled trial. So we meaning UCI, okay, got about 100-some patients with high blood pressure. They're not taking medicine anymore, and they were randomly assigned to two groups. Okay, so one group got the acupuncture needle put at points where on scientific basis it should work, okay? And the other group, unbeknownst to them, this is blinded, okay, study. They don't know, they are naive subjects, they've never had acupuncture before. Needles were put on points that scientifically speaking, it shouldn't work, okay? Now, what do you mean scientifically speaking? Because we at UCI, headed by Dr. Longhurst and his people, had already done many experiments on animals, on cats, okay? And now we're testing on humans. So in the studies on cats, we already know which points would work very well, which points would not work. So now moving to human subjects, we tested that. So this is a randomized controlled trial on patients who are not taking medicine on the side. So you can see very clearly here, not very clearly because it's not focused. So this is week number 1, this is week number 1, week number 2, week number 3, number 4, 5, and they measure, okay, continuously, okay, throughout the day, 24 hours a day, their systolic blood pressure. This is like a high number, normally you have 120 over 70. So you can see these patients, every week, the blood pressure came down and down, okay? There's no accident. This is very convincing. And the diastolic pressure, went down, 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 down. So this is probably the best study so far on the effectiveness of acupuncture for high blood pressure patients. But not just that, okay. UCI scientists and other scientists from other schools also found something very, very important, okay. Acupuncture doesn't just lower blood pressure if you put the needle here on this point. It actually resets you to the normal state. What was found was, if this is the normal blood pressure, and when somebody is high, you do acupuncture, it will come down to the normal level and no more. You cannot overdose, okay? It will just reset to homeostasis, meaning to the normal state, okay? Conversely, for people who have low blood pressure, same point, okay? Put the needle there, the blood pressure will come back up to normal, okay? So it resets your body to the normal state. So unlike taking medicine, you can overdose if you take too much, okay? So if you have high blood pressure, you take too much, this could drop and drop and drop, you can be in trouble, okay? Or go up and up, you'll be in trouble. But acupuncture, that wouldn't happen. So it helps the body reset itself to the normal state. Okay, so that's just one example of how acupuncture could be useful for this particular problem, hypertension, which is like a major problem in the United States. Now I'm going to switch to the next topic. So how does it work? What happens to the body when the needle goes in? How come, okay, the blood pressure in this case will come back to normal? Or if you have pain, how come the pain will go away, and so forth? So with that, I give you this cartoon, okay? 3 blind men and the elephant. You all know that story? Yeah? Okay. So, why do I put this up? Because we scientists, okay, tend to use our own expertise to try to solve a problem, okay? So, if I'm good at this, if I'm good at brain imaging, I'll use brain imaging as the tool to see how acupuncture works. If I'm good at, electrophysiology, I'll use electrophysiology as the role. So it's like, different people touching the elephant, and, if this blind man touches, this guy, okay, oh, the elephant is like a big snake, okay. This guy is like touching the legs of the elephant. The blind man, he said, whoa, the elephant is like a big tree, okay? You're wrong, it's not like a big snake. And this other guy is touching the side of it. No, you two are wrong. Elephant is like a house, okay? Sometimes we get into arguments like that, saying each other are wrong, because we don't have a broad perspective. We just discover something and we think that that's the only answer. So now I'm going to give you like 6 different types of studies showing acupuncture works for 6 different reasons. Okay, and nobody's right, nobody's wrong. It's just that when you use this approach to look at this acupuncture point for this disease, that's the answer. But you get a different answer if you use a different instrument to look at another point for treating another disease. Okay, so again, acupuncture was discovered by accident. It wasn't some wise man or group of wise people who just like designed this whole treatment. So, first of all, electrical measurements. This was one of the very first studies. So here's a large intestine meridian, and these are the points, number 2, 3, 4, 5, 6, 7, 8, 9 to 12. And a number of laboratories, including ourselves, okay, measure the electrical conductance at skin level, and found that if you take a probe and just go along this line and measure the electrical conductance on the skin along this line, you would see that the electrical conductance would go up and down, up and down, up and down, up and down. And when you have going up, oh, it's an acupuncture point. Go up, oh, it's another. Okay, so from this particular type of study, you can say that acupuncture points have higher electrical conductance. Okay, so far so good? Well, based on that, for probably less than $50 or less than $100, you can go buy these acupuncture point location devices, and you can get them by mail order just for fun. You can run, oh wow, okay, well, I can know the points. Nothing wrong with that, except that this seems to be an exceptional case. We have measured meridians, down the leg, down the body, and did not find this type of relationship. So this type of relationship seems to be, specific to the ones on the arm. Any place else, which makes sense. I mean, if you for $50 could buy an acupuncture point locator, who needs to go to acupuncture? Which is what they want you to pay the $50 for. So next, a little bit more sophisticated. Our close colleague, Dr. Shaosen Ma 教授 at UCLA Harvard Hospital, he did his PhD dissertation on nitric oxide. Okay, nitric oxide is a gas that goes around the body, signaling the body to do this and that. So it's a gaseous signaling molecule. Dr. Ignacio at UCLA got the Nobel Prize a few years back for discovering nitric oxide. Some of you may have something to do with nitric oxide without knowing it. If you take Viagra, it would have something to do with boosting the nitric oxide reaction and so forth. So nitric oxide will dilate blood vessels so that more blood can flow to those areas. What Dr. Ma did was, because he's an expert on nitric oxide, it seems natural for him to see whether or not meridians and acupuncture points are special in terms of nitric oxide. So here is an arm, and he puts these plastic tubes. This one here on the left, one on the right. Okay, here's another one. These are not complete tubes, they are half tubes. Okay, so it's like cutting a rubber tube, pour it all the way down, and put that on the skin, and the tube is plugged up on both sides, so that when nitric oxide comes out of the skin, it gets collected into the tube. Then they take that tube and analyze for nitric oxide concentration. Okay, it's simple as that. So he's interested in this pericardium meridian. Here are the acupuncture points, and he and his workers put these collecting tubes on both sides of the meridian or directly on the meridian and measure for nitric oxide concentration. So here's interesting, okay? So this is nitric oxide concentration on the meridian normally, as I said. But when a needle is put into an acupuncture point on that meridian, you see this jumped up. Look at that. Okay, it went from here to here. In other words, acupuncture in this case increased nitric oxide concentration locally. And I just told you, nitric oxide dilates blood vessels for better blood flow. So you can infer that, so if you put a needle, on this pericardium, okay, meridian, you're going to dilate blood vessels for better blood flow. And everything, we need a comparison. So, this is measuring like on the sides of the meridian, okay, there are no acupuncture points, and whether or not you put a needle acupuncture, there's no difference. So that's one type of study, that acupuncture increases blood flow by increasing local nitric oxide concentration. But wait a minute, okay? Yes, if your arm is sore, you put a needle right there. It's a local treatment. But sometimes your arm is sore, you put a needle here, okay? That's called distal treatment. How's that possible? This is sore, you put a needle here. Well, so Dr. Ma also looked at the slices of brain of, these are animals now, not the size of people, okay? And he found that when the needle goes in, okay, this particular part of the brain, the nitric oxide over there, distally, will go up. And other parts of the brain, it wouldn't go up. And what are these parts of the brain? These are parts of the brain to do with pain relief, okay? These are like the comparison places. So you can see that when the needle goes in, two things happen. Locally, okay, blood flow goes up because nitric oxide goes up. And then distally, okay, you signal the part of the brain that has to do with pain relief, and then you have a systemic pain relief all over the body, not just where the needle is. So a very important line of study done by our colleague Ma, Professor Ma at UCLA. Our close colleague, Dr. Cho, okay, who used to be at UCLA Medical School, Professor of Radiological Sciences. This is Dr. Cho. He made it to, this is Newsweek, okay. So, he is known widely as the father of brain imaging, okay. He's a biomedical engineer, and years ago, he's one of the pioneers of developing PET scan machines, believe it or not, okay. So it's natural for him to use brain imaging to see what happens when the needle goes in. Just like Dr. Ma is an expert in nitric oxide, he's PET scan, and also now using MRI. So here, what he showed was that here's the brain looking from the side, okay, using MRI. And you can see that, this is a subject, human subject, where the hand is put in hot water, not boiling, but hot enough to cause pain, okay. Like 50 degrees centigrade is very unpleasant, okay, but it's not going to burn the hand. So this guy is just saying, wow, this is hot water, oh, wow, okay. And you can see that his brain, the brain centers, okay, are activated. These big yellow patches are the pain centers in the brain. Then, Dr. Cho and his people put a needle, okay, to this point here, and this guy said, oh, what? It's not painful anymore. Did you like cool down the water or something? No, the water is just as hot. Okay, he doesn't feel the pain as much now because the needle is now in an acupuncture point. By the way, I will teach you all these points, okay? So you can put your hand into hot water. You see, the pain centers are now much less activated. Okay, so compare this to this. Okay, big patches of yellow here, much less. So it shows with high-tech, MRI that in fact acupuncture really works at the brain level, and in terms of the activation of pain center, this is deactivation by the needle. Dr. Longhurst, also at UCI, okay, he's a cardiologist. He was chairman of cardiology for many years. So he is very interested in how acupuncture could treat heart-related problems. He's the one who ran the clinical trial I talked about on hypertensive patients. So before he actually worked on humans, he worked on cats. You know why in a second, okay? So he had normal cats, okay, mouth, okay, and he looks at their arterial blood pressure, and the blood pressure, okay, is normally like this,